Welcome to Senior Health Video. This video will talk about 15 silent symptoms of lupus that you should never ignore. Have you ever felt your body turning against you even when every test comes back normal? Many Americans wake up each morning feeling drained, dizzy, or in pain, yet no one can explain why. They visit doctor after doctor only to be told that it might be stress or age. But deep down, something feels terribly wrong. That feeling is not imagined. For millions across the country, that hidden enemy has a name: lupus. Lupus is not just another illness. It is a silent shapeshifter, an autoimmune disease that can quietly attack your joints, your skin, your heart, and even your brain without warning. It hides behind common symptoms like fatigue fever or rashes, fooling even experienced physicians. What makes it truly frightening is how easily it goes unnoticed. Studies from the Lupus Foundation of America show that it can take up to 6 years for a person to finally get a diagnosis. 6 years of confusion, of pain, dismissed, of feeling invisible. Imagine the toll that takes on a life. The exhaustion that never fades. The frustration of knowing something is wrong while everyone else insists you look fine. The emotional weight becomes just as heavy as the physical pain. And yet most people have never even heard the early warning signs that could save them from irreversible damage. But here's the truth that offers hope. You can recognize lupus before it destroys your body. You can learn the signals your body is desperately sending and take action before it is too late. In this video, we will uncover the 15 key symptoms of lupus that doctors say you should never ignore. You will understand why they happen, what they mean, and how recognizing them early can change everything. Because awareness is not fear, it is power. And that power starts right now. Number 1, extreme fatigue. It often starts quietly, a morning that feels heavy, a body that refuses to wake up. But for someone with lupus, this is not ordinary tiredness. It is a deep exhaustion that no amount of rest can fix. Imagine waking after a full night's sleep and still feeling drained. Simple tasks like making breakfast or walking to the mailbox feel like climbing a mountain. Many people dismiss it as age or stress, but studies show that up to 90% of lupus patients live with this extreme fatigue even when the disease seems under control. This happens because lupus inflammation damages cells and blood vessels, limiting oxygen and energy delivery throughout the body. The mind becomes foggy. Focus disappears. The smallest effort feels impossible. Emotionally, it can create frustration, sadness, or even hopelessness when others do not understand the invisible battle. This fatigue is not in your head. It is a medical reality. Doctors now recommend daily fatigue tracking, balanced hydration, and gentle morning movement to help restore energy flow. Protecting sleep and avoiding long exposure to sunlight can also calm the immune system. Every small change counts. So if your body feels like it is running on empty, even on good days, listen closely. It might not be stress, it might be lupus sending its first signal. But knowing this alone is not enough, because there is another warning sign far more visible and dangerous waiting to appear next. Number 2, butterfly rash. Sometimes the first sign of lupus does not hide inside the body. It shows up on the face as a bright red, butterfly-shaped rash across the cheeks and nose. Many people notice it after spending time in the sun and assume it is just a sunburn. But this rash, known as the malar rash, is one of the most classic and visible symptoms of lupus. What makes it unique is how it spreads symmetrically across both cheeks while sparing the folds around the nose and mouth. According to recent dermatology research, up to 80% of lupus patients experience skin reactions like this, often triggered by sunlight or even indoor UV light. It is not only a surface irritation. The immune system becomes overactive, attacking healthy skin cells and releasing inflammatory molecules that cause redness, swelling, and sometimes a burning sensation. Over time, repeated flares can leave dark spots or scars if ignored. The emotional effect can be just as painful. Many patients report feeling embarrassed or anxious because their face tells a story they did not choose. Yet early recognition of this rash can be life-changing. Dermatologists recommend using high SPF sunscreen, wearing wide-brimmed hats, and limiting direct sunlight during midday hours. These simple habits protect not only the skin, but also reduce internal flares. So if you notice a rash that keeps returning after sun exposure and refuses to fade, do not ignore it. Your skin may be warning you before deeper damage begins. But knowing this alone is not enough because the next sign hides in plain sight and can trigger a reaction far beyond the skin. Number 3, photosensitivity. For most people, sunlight feels warm and healing, but for someone with lupus, it can become a hidden enemy. Even a few minutes of sun can trigger rashes, fatigue, or joint pain hours later. This extreme reaction to UV light is called photosensitivity, and it is one of the most misunderstood signs of lupus. Many think it is just sensitive skin, but research shows it is far deeper. The immune system misreads sunlight as a threat and begins to attack healthy skin cells, releasing inflammatory chemicals throughout the body. According to studies published in Frontiers in Medicine, lupus patients show changes in a cellular pathway known as the Hippo signal, making skin cells more likely to die when exposed to UV rays. This is why a simple walk outside can cause exhaustion or a full-body flare. The danger is that the inflammation does not stay on the skin. It can spread to the joints, kidneys, and even the nervous system, worsening the disease silently. The good news is that awareness can prevent these painful flares. Dermatologists advise wearing SPF 50 sunscreen every day, using protective clothing, and choosing shaded routes during midday hours. Window UV filters can also help for those who react even indoors. These habits may seem small, but can reduce flare frequency dramatically. So if the sun that once felt gentle now leaves you tired or covered in rash, do not brush it off. It could be your body's early cry for help. But knowing this alone is not enough because the next signal strikes deeper inside the body, targeting the very joints that keep you moving. Number 4, joint pain and swelling. It often starts in the morning when your fingers feel stiff and your knees ache before you even get out of bed. For many people with lupus, this joint pain is one of the earliest and most persistent signs. It is not the same as soreness from aging or overuse. The pain comes from inflammation that attacks the lining of the joints, causing them to swell, feel warm, and lose flexibility. What makes it confusing is that the pain can move from one joint to another, sometimes lasting days, sometimes weeks. Research in the journal Diagnostics found that even when joints appear normal on the surface, ultrasound scans often reveal silent inflammation beneath the skin, showing how active the disease can be even during mild symptoms. If left untreated, this inflammation can slowly damage cartilage and bone over time. That is why early recognition is critical. Persistent swelling, especially in both hands or knees, should never be dismissed as simple arthritis. Doctors recommend gentle stretching in the morning, warm compresses to ease stiffness, and low-impact activities like swimming or walking to keep circulation strong. These movements help calm inflammation and protect mobility. Eating foods rich in omega-3s and antioxidants may also reduce joint pain naturally. So when your joints speak through pain or stiffness, listen before they scream. It could be lupus whispering through your body's foundation. But knowing this alone is not enough because the next warning sign burns silently from within and often strikes without any visible cause. Number 5, unexplained fevers. It can happen suddenly. One day you feel perfectly fine, and the next you are shivering under a blanket with a low-grade fever that no one can explain. For people with lupus, these fevers are not caused by infection, but by inflammation deep inside the body. When the immune system becomes confused and attacks healthy tissues, it releases chemical messengers that raise body temperature in an attempt to fight what it thinks is an invader. The result is a cycle of heat fatigue and body aches that come and go without warning. Studies show that up to 80% of lupus patients experience unexplained fevers, often as one of the first signs of disease activity. These fevers can range from mild warmth to temperatures over 100 fever and are usually accompanied by joint pain, weakness, or chills. The danger lies in how easily they are overlooked. Many people take over-the-counter medicine thinking it is a small infection and never realize it signals something much deeper. Doctors emphasize the importance of tracking temperature patterns and noting other symptoms that appear at the same time. Regular checkups and simple blood tests can help detect inflammation before serious organ damage occurs. Hydration and proper rest can also support the body through these immune flares. So if your temperature keeps rising for no clear reason, do not ignore it. Your body may be sounding an early alarm for lupus. But knowing this alone is not enough because the next warning sign reveals itself right where confidence begins to fade, when your hair starts to fall without explanation. Number 6, hair loss. It often begins subtly. A few extra strands on the pillow, a wider part line in the mirror, a ponytail that suddenly feels thinner. For someone with lupus, this is not ordinary shedding. It is inflammation attacking the roots of the hair itself. The immune system mistakenly targets the follicles, cutting off their growth cycle and leaving hair dry, brittle, and prone to breaking. Over time, this leads to thinning across the scalp or even small bald patches known as lupus hair. Dermatology studies reveal that most lupus patients experience some degree of hair loss, often before they even receive a diagnosis. It can flare during active phases of the disease when inflammation spreads through the skin and blood vessels. The emotional toll is real. Hair is deeply tied to self-image, and watching it fall can create anxiety or sadness. Yet understanding the reason behind it can bring relief and control. Doctors recommend gentle scalp care and avoiding harsh treatments such as heat styling or chemical dyes. Anti-inflammatory diets rich in omega-3s, zinc, and biotin can help nourish regrowth. For many, medical treatment that calms the immune system allows the hair to recover naturally over time. So if you notice unusual shedding that refuses to stop, pay attention. Your hair could be telling you what your body cannot say aloud. But knowing this alone is not enough, because the next warning sign hides deeper inside, showing up in places you might never expect inside your mouth. Number 7, mouth or nose ulcers. They may seem harmless at first, small white or red spots that appear inside the mouth or on the nose. But for someone with lupus, these ulcers are not ordinary sores. They are a sign that the immune system is attacking the delicate tissues of the mucous membranes. These ulcers can appear on the tongue, the inner cheeks, or the roof of the mouth, and often they are painless, which makes them easy to ignore. Yet their presence often signals that lupus is becoming more active inside the body. Research published in BMC Oral Health found that around 1/3 of lupus patients develop oral ulcers, especially during disease flares. These sores form when inflammation damages the tiny blood vessels that nourish the mouth's lining. They can also make eating, drinking, or brushing teeth uncomfortable, adding another layer of daily frustration. The key danger is that many people assume they are from stress or irritation, losing precious time before seeking care. Doctors recommend gentle oral hygiene, using mild toothpaste, staying hydrated, and avoiding spicy or acidic foods that may worsen irritation. Regular dental checkups can also help detect early signs of lupus activity. For many, treating the underlying inflammation can make these ulcers fade within weeks. So if you notice mouth or nose sores that keep returning without reason, do not dismiss them. Your body might be showing signs of an internal storm. But knowing this alone is not enough, because the next warning sign appears at your fingertips, quite literally, when they start changing color in the cold. Number 8, Raynaud's phenomenon. It often begins in the fingertips. You reach for something cold, and suddenly your fingers turn white, then blue, then red, as the blood slowly returns. For many people with lupus, this strange color change is not just poor circulation. It is a condition called Raynaud's phenomenon, a sign that the immune system is disrupting blood flow to the hands and feet. When exposed to cold or stress, the tiny blood vessels tighten so much that oxygen can no longer reach the skin, causing numbness and tingling that can last minutes or even hours. Studies in the International Journal of Molecular Sciences show that lupus patients with Raynaud's have twice the risk of developing pulmonary arterial hypertension, a serious condition that raises blood pressure in the lungs. This happens because the same inflammation that narrows vessels in the fingers can also affect the arteries deep inside the body. Many people ignore these early episodes, not realizing they could be the first warning of deeper vascular damage. Doctors recommend keeping the body warm, wearing gloves in cold weather, and managing stress through relaxation or breathing techniques. Avoiding caffeine and nicotine can also improve circulation. In more severe cases, medication that widens blood vessels may be needed to protect heart and lung health. So if your fingers change color or feel numb every time you face the cold, pay close attention. Your blood flow may be telling you that lupus is affecting more than your skin. But knowing this alone is not enough, because the next warning sign strikes deeper, pressing against your chest and stealing the breath from your lungs. Number 9, chest pain or shortness of breath. It can happen suddenly, a sharp pain that stabs your chest each time you breathe, or a tight pressure that makes every inhale feel heavier than the last. For many people with lupus, this is not a random ache, but a sign that inflammation has reached the lungs or the lining around the heart. The condition known as pleuritis or pericarditis causes the protective layers to rub against each other, creating pain that worsens when you take a deep breath or cough. Some even experience shortness of breath as fluid builds around the lungs, making it harder to get enough oxygen. Studies show that about half of lupus patients develop some form of chest or lung involvement, and these symptoms can appear long before the disease is officially diagnosed. Because they mimic heart disease or infections, they are often mistaken for other conditions, delaying proper treatment. Ignoring these signs can allow inflammation to progress, increasing the risk of long-term scarring or heart complications. Doctors advise getting a chest X-ray or ultrasound if these symptoms persist. Rest, anti-inflammatory medication, and breathing exercises can help reduce discomfort while protecting lung capacity. Maintaining good posture and avoiding smoking are also key to supporting recovery. So if you ever feel unexplained chest pressure or find yourself short of breath after minor effort, take it seriously. It may not be your heart, it could be lupus affecting the very rhythm of your breath. But knowing this alone is not enough, because the next warning sign hides inside the mind, quietly stealing focus, clarity, and memory. Number 10, cognitive dysfunction. It often sneaks in unnoticed. You forget where you placed your keys, lose your train of thought mid-sentence, or struggle to recall simple words. For many living with lupus, this is not ordinary forgetfulness. It is a symptom known as cognitive dysfunction, often described as brain fog. The same inflammation that affects the body can also attack brain tissue and blood vessels, disrupting focus, memory, and problem solving. Everyday tasks that once felt easy begin to feel draining and confusing. Studies from BMC Neuroscience reveal that patients with higher lupus activity and oxidative stress perform worse on memory and attention tests, showing how deeply the disease can reach into the brain. Some also experience emotional changes, anxiety, or difficulty sleeping, which further blur concentration. This cycle can lead to frustration and isolation, especially when others assume it is just aging. But this fog is real and measurable. Doctors recommend improving sleep quality, staying hydrated, and engaging in gentle mental exercises such as reading aloud or word puzzles to stimulate neural pathways. Anti-inflammatory diets rich in omega-3s and antioxidants can also support brain health. Managing lupus flares early helps prevent further damage to the nervous system. So if your thoughts feel slower or your memory seems to fade for no clear reason, pay attention. Your brain might be signaling that lupus has moved beyond the body and into the mind. But knowing this alone is not enough, because the next warning sign targets an organ that works silently every second of your life: your kidneys. Number 11, kidney problems. It often begins without pain or warning. You feel fine on the surface, yet deep inside your kidneys are quietly under attack. For people with lupus, this condition is known as lupus nephritis, and it can slowly damage the body's natural filtration system without obvious signs. The immune system mistakes the kidney's delicate tissues for foreign invaders, causing inflammation that blocks proper waste removal and fluid balance. Over time, toxins build up in the blood, leading to swelling, fatigue, or changes in urine color and texture. Studies in nephrology dialysis transplantation show that patients with inflammation in the kidney's cortex are more than twice as likely to develop chronic kidney disease, even when symptoms are mild. You might notice foamy urine, ankle swelling, or an unexplained rise in blood pressure. Because these changes appear gradually, they are often ignored until serious damage occurs. Early detection is the best defense. Doctors recommend regular blood pressure checks, urine tests for protein, and staying well hydrated to support kidney function. Reducing sodium intake and avoiding unnecessary painkillers can also protect the kidneys from further strain. For those already diagnosed, consistent medical monitoring can help slow progression and preserve quality of life. So if your body begins to retain fluid or your urine looks unusual, listen closely. Your kidneys may be sending a quiet but urgent warning. But knowing this alone is not enough, because the next sign shows itself in the smallest of places, through swelling in the glands that guard your immune system. Number 12, swollen lymph nodes. It often begins with a small lump under your jaw, behind your ear, or near your armpit. You touch it and wonder if it is just a temporary swelling. For people with lupus, enlarged lymph nodes can be an early clue that the immune system is in overdrive. These tiny glands are designed to filter harmful substances, But when lupus strikes, they fill with overactive immune cells attacking healthy tissue. The swelling can feel tender or firm, sometimes appearing and disappearing with flare-ups. Research in lupus science and medicine found that nearly half of lupus patients with swollen lymph nodes had a buildup of specialized immune cells known as Langerhans cells, which are typically active in the skin. Their presence inside the lymph nodes shows that lupus inflammation is spreading through the immune system itself. Patients with this condition often experience fever, anemia, and higher levels of autoimmune antibodies, clear signs of active disease. Doctors recommend gentle massage, warm compresses, and medical evaluation to rule out infection. Blood tests and imaging can help confirm if lupus is behind the swelling. Managing inflammation early prevents further damage and restores comfort. So if you notice a lump that lingers for weeks or keeps returning, do not ignore it. Your immune system may be signaling that it is fighting the wrong battle. But knowing this alone is not enough, because the next sign does not hide under the skin. It paints itself across it, revealing how lupus can change the body's surface in unexpected ways. Number 13, skin lesions beyond the butterfly rash. Not every lupus flare shows the classic butterfly pattern. Sometimes the skin sends quieter but equally serious warnings. These appear as red scaly patches on the chest, arms, or scalp that resemble psoriasis but behave very differently. Doctors call this form of the disease subacute cutaneous lupus, and it often appears on sun-exposed areas. The rash may not itch or hurt, which makes it easy to dismiss, but repeated flare-ups can leave behind dark marks or scarring. According to the Journal of Clinical and Aesthetic Dermatology, skin lesions are among the earliest signs of systemic lupus, often appearing months before deeper organ involvement. Another form, discoid lupus, creates thick circular plaques that can permanently damage hair follicles if untreated. These lesions represent inflammation reaching into deeper layers of the skin, where immune cells attack collagen and small blood vessels. While they may seem like surface problems, they are a visible clue to systemic activity that affects the entire body. Dermatologists recommend gentle skincare, fragrance-free products, and high SPF protection daily, even indoors. Avoiding peak sunlight hours and using soothing moisturizers can help prevent flare-ups. For those already showing scars, early treatment with anti-inflammatory medication can stop further spread. So if strange red patches appear on your skin and refuse to heal, take them seriously. Your skin might be revealing what your blood has been trying to say all along. But knowing this alone is not enough, because the next warning sign dries up something we often take for granted: the simple comfort of moisture in our eyes and mouth. Number 14, dry eyes or mouth. It may start as a small annoyance. Your eyes feel gritty as if filled with sand, or your mouth stays dry no matter how much water you drink. For someone with lupus, this is more than dehydration. It is a sign that the immune system is attacking the glands that produce tears and saliva. This condition often overlaps with secondary Sjogren's syndrome, another autoimmune disorder that amplifies dryness and discomfort. Over time, it can lead to burning eyes, blurry vision, and increased risk of cavities or mouth infections. Research published in BMJ Open confirms that dry eye disease is one of the most common complications in lupus, affecting nearly half of all patients studied. The loss of natural moisture happens when inflammation damages the glands responsible for lubrication. Without enough tears or saliva, the body's first line of defense becomes weak, making daily life uncomfortable and sometimes painful. People often find it difficult to speak for long periods or swallow dry foods, which can affect nutrition and confidence. Doctors suggest using preservative-free artificial tears, humidifiers, and sugar-free lozenges to ease symptoms. Staying hydrated and avoiding alcohol or caffeine also helps maintain moisture balance. In more serious cases, prescription eye drops that reduce inflammation can bring significant relief. So if your eyes sting or your mouth feels unusually dry every day, pay attention. It could be lupus signaling through the body's smallest but most essential glands. But knowing this alone is not enough, because the next warning sign is one of the most serious of all. It affects life's very beginning and reveals how lupus can influence the miracle of pregnancy itself. Number 15, recurrent miscarriages or blood clotting. For women living with lupus, one of the most heartbreaking signs appears during pregnancy. Recurrent miscarriages or unexplained blood clots can be a direct result of lupus-related immune activity. In some cases, the body produces abnormal antibodies called antiphospholipid antibodies that attack the cells lining blood vessels. This condition, known as antiphospholipid syndrome, makes the blood unusually sticky, forming tiny clots that block oxygen and nutrients from reaching the baby. Even outside of pregnancy, these clots can cause serious complications such as stroke or deep vein thrombosis if left untreated. Studies in BMC pregnancy and childbirth show that antiphospholipid antibodies are among the leading causes of recurrent pregnancy loss and pregnancy complications in lupus patients. They can trigger preeclampsia, premature delivery, or fetal growth restriction. Yet with early testing and treatment, many women go on to have healthy pregnancies. The most common therapies include low-dose aspirin and heparin, which thin the blood and prevent clots from forming. Lifestyle habits such as staying active, maintaining hydration, and avoiding smoking further lower risk. Doctors urge anyone with lupus who plans to become pregnant to seek specialist care before conception. Close monitoring can protect both mother and baby from preventable harm. So if you or someone you love has faced multiple miscarriages or sudden blood clots, do not dismiss them as coincidence. Your body may be signaling that lupus has reached the bloodstream itself. But knowing this alone is not enough because the story of lupus does not end with symptoms. It continues with awareness, early action, and the power to take control before it takes control of you. Lupus can be silent, confusing, and overwhelming, but knowledge turns fear into strength. You have now learned the 15 warning signs that your body may be using to ask for help. From fatigue and skin changes to deeper symptoms like chest pain or kidney trouble, every signal matters. Recognizing them early is not about fear. It is about power. It is about giving yourself or someone you love a chance to act before the disease takes more away. If any of these signs feel familiar, do not ignore them. Talk to your doctor, ask for blood tests, and keep a record of your symptoms. Simple awareness can save years of pain and uncertainty. Remember, lupus is not the end of health. It is a reminder to listen, to act, and to protect your body with care. Many people who once struggled in silence now live full and balanced lives because they learned what to watch for and took the right steps at the right time. You are not alone. There are millions who understand exactly what you are going through, and there is hope in every new piece of research and every story of recovery. Healing does not start in a hospital. It starts with understanding, compassion, and a choice to take control today. If this video brought you clarity or comfort, save it now so you can return to it whenever you need a reminder. Subscribe to our channel for the latest health education, safe remedies, and new discoveries in senior wellness. Together, we are building a community that values awareness, prevention, and longevity. Stay informed, stay hopeful, and take care of yourself every single day. Because when you take one step toward your health, your body takes 1,000 steps back toward you. And remember, the next video will uncover foods and daily habits that protect your immune system. Naturally, do not miss it.